So the artery takes blood to the extremities and to the brain and to the heart, et cetera, but that's the inflow of the plumbing. The drain of the plumbing are the veins, and that is how the blood gets back to the heart to get reoxygenated and gets sent back out to the rest of the body. Venous disease is if the blood in the legs, for instance, was not returning to the heart as it should, and it sort of gets stagnant there, like a column of water or something would get stagnant in a stream, then that causes disease problems. It can cause ulcerations, swelling, varicose veins, and what have you. And that's usually a problem with the valves in the vein. The valves keep the blood directed back toward the heart, and if they're not working right, then they leak. So if you got leaky plumbing, it causes vein problems. Symptoms would be swelling of the lower extremities, achy pains, restless legs at night is a big one, but seeing large veins and especially dark discoloration on the medial sides of the legs is more of an indication of more severe venous disease. So large ropey veins, discoloration, pain, those are the things that people usually present with. Well, we treat most people with compression stockings initially, and that should at least do the trick for most people. If they have bad valves and despite the compression stockings they still have symptoms, then we can actually close the veins down, usually percutaneously through a tiny 2 or 3 millimeter incision. We put a catheter inside the vein and use radiofrequency energy, which is like microwave energy, to close the vein down from the inside. So we do that, it takes us 15, 20 minutes, and they get up and go home afterwards. Yeah, well, actually we do really the spectrum of venous problems. We were some of the first people in the state that I know of that recognized iliac vein compression syndrome. It's called Maythurner Syndrome, but it's where the iliac vein, which is down in the lower portion of the abdomen, gets compressed by the artery and compresses the vein against the spine, and the blood can't get out of the leg. So people get lots of problems with venous hypertension, if you will, in that leg. And when we recognize that, we can actually put a stent in there. So we put a stent there, we can actually measure the sizes we need and the length we need and treat it. And it's just very impressive how fast they get relief of their symptoms. The patients that just have spider veins, the little bitty cosmetic type problems in the legs, we treat with a special light where we can see the vein well and magnification, and we inject those with the one of two things that's approved by the FDA, and that usually makes them go away. If it's more of a varicose vein problem, and if the main saphenous vein or the saphenous vein on the back of the leg, which is called the small saphenous vein, are bad, we close that down with the radiofrequency catheter that I talked about. Sometimes we'll take out the branch veins, and we do that again through small incisions. Those are done back in the VAC, or the Vascular Access Center. Also, if they have that Maythurner Syndrome, then we can treat that in the Vascular Access Center, and we actually have an anesthetist that comes in and gives anesthesia for that, so the patient sort of sleeps through the whole thing. Same way with the vein closure. Well, I think having the Vascular Access Center in our office, both for venous and arterial disease, makes us much more efficient. So we can actually do a lot more efficiently in our own access center. We can get the instruments that we need and the stents and what have you that we need and have them available. And that way we can, we don't have to wait for COVID to open up to let patients come back in the hospital. We can do them in our office and get it done. Well, the IAC accreditation, it means we have met the standards for a vascular center, a vascular lab. It's continuing excellence to make sure that we're doing what we need to be doing for the patient's good.